Despite its calm exterior, it's not business as usual for Barnet Council today. Mental health social workers have crowded its entrance for the third day of striking. They're protesting what they describe as chronic staffing issues and waiting times that reach up to 14 months. Calling the service unsafe, many of them worry about the impact this has had on vulnerable residents.
The service is so stretched, you can really only deal with crisis level work, and you feel like you're letting down the residents because you can't see them for sometimes up to 12 or 14 months, until they're in crisis, because then they might get to the top of the queue. Is really at odds with social work values, and I've found that really hard, to be honest, to know that the job that I wanted to do, the job that I trained to do, that I changed careers to do, isn't actually possible because there are no resources.
The last year has been especially tough. UNISON has reported that out of a cohort of 31, 14 members of staff have left, with one soon to also hand in their resignation. It's now calling for practitioners to receive a 20% market supplement on top of pay to retain staff. This is in line with market supplements of up to 25% paid to the Council's family service social workers. Instead, Barnet has offered £1,000 per year for the next 2 years, worth 2.6% on average.
That if this carries on, there won't be any social workers in Barnet because they'll all be leaving, just like our colleagues have done. Lots of them have left. I've worked in Barnet since 2008, and a lot of my colleagues, experienced social workers, they've already left. And we've got young workers who are coming in, especially working in mental health, and they need that support of colleagues who've worked in the service for a long time, so they can learn from them.
Among those protesting are many newly qualified social workers, a testament to the service's loss of experience in the past year. With seasoned staff gone, many of them have been left working on complex cases without proper support or grounding.
As students and newly qualified, we were kind of left with quite complex and high-risk cases, and don't get me wrong, our manager in the team is amazing, but that's not enough. You need a strong workforce of experience, people who have been in Barnet for a while, know the processes, and know the everything like that. It was super tricky.
3 days into striking, practitioners are disappointed at the Council's lack of contact. The initial 6 days of strike action have been extended, with 26 more dates added, reaching up to March 2024. In a statement to Community Care, Councillor Paul Edwards said that 30 of the posts were already filled, 26 by permanent staff and 4 by locums. Earlier this year, the Council had also added 5 extra practitioner posts and increased approved mental health professionals' pay by 10%. According to Edwards, its recent offer, in addition to the annual pay award, placed the Council at the top of the salary range paid by local authorities. However, UNISON branch secretary John Burgess says social workers won't be backing down.
There is no alternative. The only alternative for these workers is to leave and go somewhere else. That has a negative impact on service users in the community because it means that the workforce is not consistent. They don't know the client base. They can't